ncIMPACT is made possible by funding from Civic Federal Credit Union. ncIMPACT is a production of UNC-TV Public Media North Carolina in association with the University of North Carolina School of Government.
Hey, Miss Liz, how are you? You know my voice now. We just see a huge growth in our community. We sit right in between two major hospitals. They've reached out to kind of the outskirts of our community towards more of the rural areas, and so we see that a lot of our folks have easier access to care. They can get in. Being a small town, there's that hometown feel, and I feel like everybody kind of goes above and beyond to try to help those folks.
Education, jobs, health, all these issues affect you. Leaders from across the state, people just like you, are working to make things better. The question is, could you do this in your community as well? I'm Anita Brown-Graham. This is ncIMPACT. Hundreds of thousands of people move to urban communities in North Carolina every year, while many rural communities in the state are seeing a population decline. Those rural communities often confront a shortage of physicians, hospitals, and urgent care centers. Let's look at the impact of community forums in McDowell County that help to break down some of the barriers to healthcare access.
So the pilot community that we started working with was here in West Marion, and it just kind of took off from there. We hosted 4 community forums, and the first forum was really all about, well, what is your vision for West Marion? Because a lot of the times you come into a community and you talk about all the problems and you talk about all the challenges, and we really wanted to talk about the assets and the strengths and really take that approach.
When I came into it, I come to just see what it was about, but I got inspired to see what was possible.
What we wanted in bringing a community forum is we wanted to celebrate our similarities. It seems like in this day and age we focus a lot on our differences. So often we sit and wait for other people to bring change to us. Leadership begins within you. And the more people that you bring together, the more change you can bring to your community.
The work that we've done has been across the county, so it's been great to collaborate with all of these forums as they grow, because healthy food, active living is always raised as an issue that they want folks in their community to be healthier.
Our community garden is called the Tabernacle Community Garden. We want to create a space where we can grow food and healthy food for people. But what I've seen in the garden is more of a relationship building. I've seen more people come together and bond, people learning about gardening, people learning about each other, people learning about themselves.
The change is there, the possibility is there, we just have to reach in and all work together to make it happen.
There's this quote I saw on the Berlin Wall, and it says, "Many small people from many small places do many small things that change the world." And that's what we're doing here in McDowell County.
Communities taking charge of their health. Well, Calvin Allen, this is something you know a lot about, isn't it?
Well, I've learned a lot over the past 4 years, getting to work with a lot of different communities through the Healthy Places North Carolina initiative.
Tell us a little bit about the challenges rural communities face in terms of healthcare access and health outcomes.
Well, certainly in terms of access to care, you're covering the gamut. One is just being more spread out. Getting to healthcare facilities is a big issue, and sometimes it's not within the county boundaries. They don't mean as much in rural communities. I may need to go over the border to get kind of what I need from the health center that's closest to me. So that's one issue. And then also, of course, the economics of, a lot of us get our health care. I get my health care through my employer, and when those employers go away, when the big businesses go away, the manufacturing goes away, there's a need for alternatives for that. So a lot of folks are trying to figure out, how am I going to pay for my health care? And of course, there are people on all levels, whether it's local, state, and federal, that are working on that in different ways.
I am really impressed by the community forums in McDowell County, in part because of the breadth of people who are taking part in those conversations and the resulting breadth of areas for innovation that stem from a conversation that began about health. Do you see this happening a lot in North Carolina?
It really is. You know, people don't often have the opportunity to really just sit down and address what's going on, and that's the power of the West Marion Community Forums and the East Marion East Community Forums and Old Fort Community Forums. They're growing there, and across the state, what we're seeing is that with a little help, that people are willing to come together to kind of look at what are the issues, what are the impacts, and brainstorm together what are some innovations, what are some things that we can do. But it really takes leadership, and that's the really key piece, is having folks say, why aren't these people at the table? And noticing that they're not at the table, and reaching out to local community voices to find out kind of what's really going on.
So what happens to communities that are not fortunate enough to be in the Healthy Places program? Are there places they can go online to get some of the resources they might need?
Yeah, absolutely. I mean, I think in terms of, number one, folks are always welcome to call us, and we'll share the resources that we know about. But additionally, one of the things, early in our process, we wanted each county to come up with their own ideas, and not just replicate what the other county was doing. But 5-6 years in now, we're recognizing that a lot of the communities are coming up with some similar ideas, doing it in their own way. And we're now starting to bring people together for statewide meetings around behavioral health or healthy eating or active living, and looking at, well, you did it this particular way and you included these folks when we didn't include those folks. Why did you do that? And they're noticing some kind of core elements that make the program strong. And so we're documenting those things, and they're sharing. They're using that to kind of advocate that here's an example of good policy that other folks can use as well. So that's kind of the next step as we're moving forward.
Thank you so much for being with us.
Thank you for having me.
Thank you for the work that you do.
Thank you.
In McDowell County, house call medicine is making a comeback. But instead of a doctor, it's a paramedic making the house call. Let's look at the impact of a program that is helping patients avoid costly trips to the ER.
Lucille and I have known each other about 3 years.
So we developed the Community Care Paramedic Program in 2013.
Have you been seeing your doctor regularly like you're supposed to?
The goal of the Community Paramedic Program is to prevent 911 calls from occurring.
All right, you can just relax your arm there.
We know that by connecting patients to the right resources, we can improve their health and decrease their use of EMS services.
Let me take your blood sugar now. Okay?
Traditionally, paramedics are responding to emergencies. It's a different transition for these folks to go through, because now community paramedics work on the front side to prevent an emergency from occurring.
I do go to her home normally to see her, but I've took her to the doctor before, or went and took her to get groceries or things like that that she has trouble doing sometimes.
And we approach every patient with a case-by-case basis. What works for one may not work for another, but we go into it with an open mind, saying, let me get you to the people that can help you.
It means a lot. It sure does. It means a lot. I'm glad y'all can come, you know. I'm glad I'm in this. So it makes me feel better.
McDowell is one of the few EMS agencies in North Carolina that is seeing a decline in our 911 volume, and we attribute that to the work our community paramedics are doing within the community.
I'll come by and fill your pill box, okay?
Okay.
And it's one story after another that we have that really demonstrates the impact that our program, working with many community programs together, is moving the needle.
Okay. I love you.
I love you too.
Bye. God bless you. Go get you something to eat, okay?
And here to talk about health in communities like McDowell is Dr. Robert Bashford. Let's talk a little bit about patient navigators. In McDowell County, there is this program where they are using EMS personnel to go into homes, and rather than being responsive to the 911 call, they're actually trying to prevent it. That's a very different way of thinking about providing health care.
We did it all wrong, and I'm part of doing it wrong. We treated people on the far end when they were sick instead of keeping them well on the front end. So population health has become so important. This person you're talking about, we can also keep them in their home. We can keep them in their home, and if you went, we talked about this, if you sent 3 or 4 people into a home to make a difference, you would send a nurse, a social worker, an occupational therapist, and a handyman.
Say more about that.
Okay. Occupational therapist is going to go help the older senior get back to Walmart shopping, get back into the world. The social worker is going to talk to them about the relationship they've got with their estranged children and how to manage that. The nurse is going to look at their meds, while the real player, the handyman, is going to be putting handles in their bathroom and on the steps and save their lives.
So here's the hard question. How are you training doctors to be part of that kind of ecosystem?
We pick them. First, we pick kids that think this way. I call them kids. We pick young people that think this way, that come into it thinking this way. Keeping people healthy being more important than treating them at the end when they're terribly sick. Health literacy, you have no idea what people hear when you talk about, say, diabetes. What do they hear? What do they know? It hadn't made them sick. So we want people that understand that the patient doesn't understand.
There are 80 counties in North Carolina that are designated as rural, and you are focused on creating opportunity for those places to have primary care physicians. Would you talk a little bit about your focus on rural health?
The focus began, Anita, 7 years ago when the Keenan Trust began a program putting young people out into rural North Carolina in primary care, forgiving a big portion of their debt so they could do it. What we learned going to Alabama, Wisconsin, was pick a kid from a rural setting and get him into med school first. Get him or her. Don't bring them into a different portal because you can't afford to have them fail out of med school. So we're 50 strong now, and we're doing the same thing with interprofessional, occupational therapy, physical therapy, allied health. We're doing the same thing with them.
So back up for a minute for me. What was the problem you were trying to solve?
The problem is the problem that you're talking about in McDowell County. People in medicine tend to go to the interstates and live on 77, 40, and 85. They don't go into rural settings. So when you look at the state, look head on to the state, top right, bottom right, far left, there are no docs, there's no dentist, there's no mental health care, and everybody is sicker in rural areas than they are in urban areas.
And so how difficult is it to identify those students and encourage them to start their practices in rural areas?
There's one thing I can do fairly well, and that's pick the kid that genuinely wants to be in a rural space.
How do you do that?
Because they talk funny sometimes, like I do sometimes, but they're smart. And they came from a rural space, and they love that idea of that community, and they want to go back there and be a part of a community. They want to be the vice mayor, they want to be on the school board. They want to be a part of a community, not just go to work and go home.
These days, technology allows us to connect to just about anyone. In McDowell County, that includes connecting students to doctors. Let's look at the impact of how the school district is using telemedicine to keep their students healthy.
Hi, Meredith. I'm good, thanks. How are you?
Healthy Schools is a school-based telehealth program that makes it possible for kids, as well as faculty and staff, to receive healthcare services where they spend most of their time at school.
Yeah, I've got Luke here. He's not feeling so good today.
We have really good healthcare providers in our community. We just don't have enough of them. And so while they do wonderful work, they might not have enough slots in their schedule. Kids who would otherwise not receive any care have access to care.
Take a deep breath. It doesn't require the kid to be out of class, because they can sit in class and wait for the prescription just like they could be sitting at CVS and wait for it. So we're able to get the teaching done at the same time with making sure that their health needs are taken care of.
Okay. I started school nursing itself 19 years ago, so 19 years ago I would never have thought that we would be doing it quite this way. Oh, the kids love it. They're like, oh, this is cool, I can't wait to do that, or that's so neat, and especially if they get to see inside their ear, things like that. I was like, wow, I didn't know that. So they really like that. Okay, Luke, you're gonna have to pack up and go home with Strep positive, and we'll let Mom know to come get you, okay?
It's inexpensive, it's easy, it's a no-brainer in a lot of ways, and I would like to see healthy schools available to every kid in every school, at least in North Carolina, if not all over the country.
Thanks, Meredith.
You're welcome, thank you.
Really excited to be joined by Maggie Sawyer. Maggie, what's the big deal around telemedicine? Why should we get excited about this?
It finally gives us an opportunity to reach folks in rural communities that may not have had access otherwise. And with physician shortages and healthcare shortages, this gives us an opportunity, gives us a chance.
So I gather that a bunch of folks who are watching us at this moment are thinking, well, surely there is a dearth of specialists in rural areas, but in North Carolina, why telemedicine for primary care?
Well, over the years, a number of our physicians have either retired or people have chosen not to go to rural areas. And so we've been seeing kind of a steady loss, if you will, to primary care physicians in rural areas. So without the ability to recruit and retain folks there, we really have to figure out new and innovative ways that we can make sure people get access to the care that they need.
And McDowell County is using school-based care to provide this telemedicine. How excited are you about that as an innovation?
Oh, it's astounding, because when you impact children's health at school, it impacts what happens to their parents in terms of having to leave work, you know, to take them someplace. It makes sure that kids get to stay healthy, and they get to stay in the class. So, and it also gives the opportunity for their parents to begin to see what a primary care home could look like for their kids. And when their kids' health improves and stays improved, it also impacts the entire family.
So talk to me a little bit about rural health in North Carolina as we're looking at the outcomes of a program like this one in McDowell County. What should we be looking for in terms of long-term trajectory?
So the things I think that are important to look for are children who receive good health care in the early years will continue to realize good health outcomes in the future. So it's an investment in our rural communities. And those investments mean that even when they have their own children, they'll understand what good health care can bring as well. So it's part of it is quantifying, you know, that people got a checkup, they got their vaccinations, they got the kind of well care that they need, but having an opportunity for those kids to go and see someone that they trust, and that person may be via a television, you know, a screen. And kids are really excited about that. They do that all the time now, so
Indeed.
It's very natural for them to do it. And so we just want to make sure that families can continue to be as productive as they possibly can, because parents are able to stay at work, kids are able to stay in the classroom, and that perpetuates a good standard for care in the future.
Love it. Thank you so much for being with us, Maggie.
Thank you for having me. I really appreciate it.
We all share many of the same challenges in our communities, so why not share the solutions as well? Each and every one of us can make a difference. That's what having an impact is all about.
ncIMPACT is made possible by funding from Civic Federal Credit Union. ncIMPACT is a production of UNC-TV Public Media North Carolina in association with the University of North Carolina School of Government.